Typical recovery after knee replacement encompasses about a 3-month time period. I kind of break these into a few different portions. The first 2 weeks after a knee replacement, I tend to call the "what did I get myself into" phase. This is a normal time where you have quite a bit of soreness from the surgery itself. This is where that ice pack machine comes into play and really helps with your swelling, along with the anti-inflammatories and sometimes the pain medicine as well. After you get past that first 2 weeks, your pain gets better week by week. For the first 6 weeks, you're doing physical therapy, where you're going to a physical therapist's office and you're working on your knee range of motion. It takes about 6 weeks to get your full motion back. After that 6 weeks, you can really start getting back to any activity that you want to do. I will see you in the office at 2 weeks after surgery, and then again at 6 weeks after surgery, and go over these things with you again as well. Total recovery is about 3 months. So as a reference point, patients who are going back to a desk job can go back typically at the 6 to 8 week mark. Patients who are going back to a more of a manual labor job where you're up and walking throughout the whole day, it's about a 3-month time period. Physical therapy is a vital part of the recovery after a hip or knee replacement. Typically, after you go home on the same day of surgery, you're being set up to see a physical therapist in their office within a day or two of surgery. This really allows you to get up and moving and ambulating quicker, and allows you to get back to your life at a quicker pace. The physical therapist can help decrease some of the swelling you have around your surgery site. They will reinforce different tips and tricks for getting around and getting up and getting back to life in a quicker fashion. So I get the question a lot about when can I get back to work after a joint replacement. So for a knee replacement, if you're getting back to a desk job or a job where you don't have to do a lot of walking, typically you can get back in the 6 to 8 week range. If you're going back to a manual labor job where you need to be up on your feet throughout the day, it's probably a good 3 months before you're getting back to that job on a full-time basis. Often I get asked what limitations a patient may have long-term or lifelong after a hip or knee replacement. In general, I encourage my patients to be as active as they want to. The only real restriction I put on patients is, say, if they were a marathon runner prior to coming in. I don't suggest you get back to doing marathons again, as you can really wear out that joint replacement a little quicker. But I really do encourage you to get back to things like riding your bicycle, playing basketball, playing tennis, things you would normally do to be active and stay healthy. I really encourage you to get back to doing those things.